My name is Laura Serbu. I'm an internal medicine physician as well as a preventive medicine physician. So I spent 2 years of training just focusing on prevention, and that also includes preventive screenings such as cancer screenings. And we'll be focusing on different ones today, including one that's not cancer related, but there's a lot of different preventive screenings out there. We'll start off with why we screen, and we'll also talk about who decides about screening tests, who decides whether it's worthwhile or not to have this even be offered to a patient or to a person. We'll spend the most amount of time actually talking about the individual screening tests, and then we'll finish up with a very brief plug about vaccines. So this will be more of a brief overview of each one. The reasons why we screen are beyond just these three here, but the main ones are we want to try to catch a condition early before someone might have symptoms of a condition. It might be getting started in the body, but it's just so small or just in the early stages that the body doesn't even register it and no one's actually feeling off or anything. So with that in mind, a lot of these conditions, there is a phase where someone is feeling totally fine, and there is that phase where we can actually catch it before it does damage and before it can cause problems. And with that in mind, that's the second part here. We screen to maybe get the opportunity to treat and even cure some of these conditions, many of which are cancers. And last but not least, the most important part is to try to prolong life. If we can catch a cancer early, in some cases, the treatment options are better. For example, if someone got diagnosed with colon cancer at 65 and we're able to catch it early and treat it early and maybe even cure it at that time, that person can live until they're 80 or later. The main goal for so many of these screenings is that we want to prolong someone's life if we're able to. These are the three main reasons. Who decides about screening tests? The main group that is deciding which screening tests can be helpful to a community of people is called the U.S. Preventive Services Task Force. So the acronym for this group is USPSTF, and this task force is made up of 20 or so different people, many of whom are doctors. Some of them are also scientists, some of them are doctors who see patients still, but they're all in different fields related to primary care. So internal medicine, pediatrics or care for children, obstetrics and gynecology, and all of them have expertise and experience looking at research that's out there in the world and data that's out there in the world that talks about screening tests. And this data talks about whether the screening tests are related to the things we just talked about. Can these screening tests catch a condition early? Can it help us prolong life? And they look at all the data and they decide whether it's worthwhile to recommend it to the whole country. There are other groups out there that talk about screening tests. It can be confusing at times when one person hears like, oh, the United States Preventive Services Task Force recommended this for mammograms, but the American Cancer Association recommended this for mammograms. And it can be a little bit confusing, not only for patients, but for doctors too. But the reason why this group is really important and why I'm focusing on it is actually because what this group says is related to what insurance companies will pay for. The United States Preventive Services Task Force decides recommendations on screenings, and thanks to the Affordable Care Act, also known as Obamacare, back in 2010, they decided that whatever this task force says is good for screening people, which in more detail is like they give different grades, and so a grade A or a grade B, like good scores for screening tests, then insurance companies have to pay for those tests for a person, and the person should not be paying like a copay or other things, basically to make it as accessible as possible. I mean, granted, we can make it more accessible than that, but to not let cost be a barrier to getting these prevention screenings. The first one I'm going to be talking about is lung cancer screening, and each of these screening tests I'll talk about in the same way. So as you can see here on the left, I'll talk about first who is eligible to be screened. If they were to go to their doctor would say like, yes, you should get this screening test. Let's make it happen for you. Because some of these screening tests actually aren't available for everyone, because some of the things that we'll be talking about put someone at higher risk for these different cancers. Some of these screening tests aren't for everyone. And then on the right here, I'll actually talk about the screening test, like what it entails. I won't be going necessarily into the details of like the risks of a screening test or things of that detail. So first things first, lung cancer screening. People who are eligible are those who smoke. The definition of smoking is pretty high. So it's someone who's actually smoked like a pack a day for 20 years. So that's quite a bit of smoking. So if someone has smoked less than that in their lifetime, they're not eligible for that screening test at this time. And they have to be between ages 50 to 80 years old. And the screening test that's recommended is a CT or a CAT scan of the lungs. A CAT scan is like a very fancy X-ray, I like to call it. It's a very quick test, it's painless, and the recommendation is for someone to do it every year until they're outside of this age frame, or if they had quit smoking quite a long time ago. This one has a pretty high threshold to be eligible, smoking quite a bit over one's lifetime, a pack a day or more for 20 years, or something similar to that amount. This screening test is not related to cancer, but it's actually still related to smoking. This one's called abdominal aortic aneurysm screening, and I'm going to talk about what all those words mean in just a second. But people who can get this screening are actually men who have ever smoked in their life. This cutoff is a lot lower than the last one. It's men who've smoked 100 cigarettes or more in their life. So pretty much if someone considers themselves to be a smoker, they've probably smoked more than that. And they have to be between ages 65 to 75 years old. The screening test is an ultrasound of the belly. Again, a very painless test. And it only has to be done once within these 10 years. So going back to what these three long words mean. So essentially, the aorta is a blood vessel that goes from the heart and it goes into the belly, and then it spreads off into a lot of different blood vessels. And in the middle section, in the part where it's in the abdomen, this is on the left what a healthy aorta or large blood vessel in the abdomen looks like. And for someone who has a history of smoking, that blood vessel can kind of get bigger and pouch out like this. The fancy medical term for that is aneurysm. Men who smoke have a higher risk of having the blood vessel in the belly get really big. And when it gets really big, it gets also at risk of bursting. And we obviously don't want that to happen in the body. It's very dangerous. And so we have enough data to show that for people who smoke, a screening test to just take a look at the belly, take a look at the aorta and the size of it can save lives, because if it's bigger like this, there can be surgery to be done to fix it or to prevent it from bursting in the future. You may be asking yourself, well, why is it men who've ever smoked? What about women who've ever smoked? The reason why men are included and not women is that we actually don't have the data and the research and the studies to show that women are also at risk. Hopefully we can get that data done soon so that if that's the case, this can be changed. Because what's really great about the United States Preventive Services Task Force is that every several years they relook at the guidelines and they see what new data has been come up with, new studies have been published, and they decide if they need to change the recommendations or not. So it's still possible in the future for this to be people who've ever smoked, but for the time being, it's men who've ever smoked. I'm going to colon cancer screening. So this one is more of a screening for everyone. So it's people ages 45 to 75 years old. Those who are over age 75, there's still an option to get screening for colon cancer. It's recommended to talk to your doctor. Some people it is worthwhile to do. For some people, it's less of a recommendation. And the screening test, there's many different screening tests out there, which I think is great because then people can choose what works best for them. The one that I think a lot of people are familiar with is a colonoscopy, and this is done every 10 years. Sometimes with less time in between, depending on the results of the first colonoscopy. But there are also options for a stool test. So someone can just do this in their home and then send it back. That's done every 1 to 3 years, depending on the test. There's also something called a sigmoidoscopy, which is kind of an in-between option. It's not as involved as a colonoscopy, but at the same time, it doesn't get a chance to see the whole length of the colon. But I just wanted to mention it briefly briefly because it's less talked about, but it is an option that's offered every 5 years for someone. That person doesn't need to go under anesthesia for it. So there's some benefits to doing this potentially. So there's a photo of the colon. So that's the intestine in our body that holds stool. Essentially, this part of the colon also has a risk of developing colon cancer. And so what a colonoscopy is a camera that goes into the colon and takes a look at hopefully the entire length of the colon. What's good about a colonoscopy is that if the doctor sees signs of something that could develop into cancer, they're called polyps in medical terms, like little pouches or little bumps on the colon. The doctor can actually clip those off and hopefully prevent cancer from developing down the line. So that's what's really great about a colonoscopy. What's a little bit hard about a colonoscopy is that someone needs to go under anesthesia for it. So medicine to help someone fall asleep for like 10, 15 minutes. So then someone needs to get picked up after the procedure and taken home with a chaperone. There's some preparation before a colonoscopy because for the doctor to get to see all the parts of the colon with their camera, someone needs to essentially pass all the stool that's in their colon the night before. And so it can be a little uncomfortable, to say the least, to be having so many bowel movements the night before a procedure. So that's something to consider and something to talk about with one's doctor in more detail. But this is considered essentially the gold standard of colon cancer screening because someone can see the colon and take things that might be cancer down the line out. However, that's not to say that these other tests aren't great either. They're totally acceptable tests. It just kind of depends on the person and what they prefer for their colon cancer screening option. This next one is breast cancer screening, and people who are eligible to be screened are women ages 40 to 74 years of age, and the screening test is a mammogram, and the recommendation from the United States Preventative Task Force is for this mammogram to be done every other year. This is a screening test in particular where different groups have given different recommendations, which can be kind of confusing. Some groups say every year is preferred. This group, as I mentioned, every other year. Myself, when I talk to a patient about what they prefer, if someone wants to get a mammogram done every year, I support them in that. If someone wants to get it done every other year, I support them in that as well. So it really depends on what the person prefers. And here is a photo of a mammogram machine. And essentially it's a way to get to see what the breast tissue looks like and see whether there's any concerning areas that could be growing into cancer or are cancerous already. And so it's definitely recommended for women ages 40 to 74 to get a mammogram done. This last one is cervical cancer screening. Just as a brief review of what is the cervix, because it's not as talked about as other organs in the body, but this image here on the left is of the uterus, if we could see through it. So here's the uterus. Here at the bottom is the vagina, and the cervix is the area that is between the uterus and the vagina. Essentially, it's the opening towards the uterus. The cervix, unfortunately, can develop cervical cancer. And so the recommendation is that for people who have a cervix, ages 21 to 65, undergo cervical cancer screening, which is also known as a pap smear. And a pap smear is something that can be done every 3 to 5 years. What is done is that a brush like this is used to brush the cervix to get some of the cells of the cervix and to just take a look at whether those cells are concerning or not for cancer. And the reason that actually I wanted to talk about cervical cancer screening last is because I wanted to connect it with a vaccine called HPV vaccine, and HPV stands for human papillomavirus. I think the only vaccine that we have that prevents cancer. Cervical cancer is most connected to the human papillomavirus or HPV. By having the HPV vaccine, we've been able to bring down the levels of HPV in the population. And then by doing that, we've actually brought down cervical cancer, which is amazing and awesome to say the least. And the HPV vaccine, just very briefly, initially recommended for adolescents because we wanted to prevent HPV from being contracted in the first place, for lack of a better phrase. But this HPV vaccine has been broadened out to be for, I think, most adults until age 46. This vaccine has been incredible for reducing cervical cancer. And so something else to talk about with your provider, or if you're someone who has children and they're in that age, the HPV vaccine is definitely recommended. recommended. In summary, to kind of connect it to vaccines in general, screening tests are a form of prevention, a form of preventive medicine. We want to prevent conditions from happening. We want to prevent cancer from happening or to catch it early if it's there. And we want to prolong life. And vaccines are prevention too. A lot of the different vaccines we've talked about so far are to prevent conditions from happening or to make them less severe if they were to happen and to prolong life. At the end of the day, I think we all want to lead healthy, long lives. What we know is that after someone has quit smoking at about 15 years out, their risk of lung cancer is about the same as someone who hasn't smoked. Now, that risk is not zero for anyone. Like, there are people who get lung cancer who've never smoked in their lives. So that risk is still there. The risk is not higher after 15 years of being smoke-free. And so then it's no longer recommended to have someone undergo these yearly CAT scans of the lungs. That's what we know so far. I always say these screening tests, and as we all know, medicine in general changes based on more research, more data, more studies. And so it could very well be that maybe down the line, we get information that actually it has to be 20 years out, not 15 years of being smoke-free. But just with the information, with the data that we have, it's not recommended for screening tests to be done after 15 years of being smoke-free. That being said, these screening tests are for people who don't have any symptoms to begin with. And the second thing I'll say is that these screening tests are recommended for population level and whether insurance will cover them or not. For example, if someone has a history of smoking and they have the money to pay for a CAT scan every year to keep getting screened, no one will prevent them from doing that, but it's just crazily expensive, some of these tests. So unfortunately, some of these screening tests, the way they're done, we might not catch all the cancer that's out there just based on how it's recommended for different reasons. Hemorrhoids are not related to cancer. What gets a little bit confusing about hemorrhoids is that people with hemorrhoids, a symptom is blood in the stool sometimes, on the stool or on the toilet paper. And a symptom of colon cancer is also blood in the stool, but usually to much larger amounts than what can be seen in hemorrhoids. It's hard to quantify that really, but it's just something to keep in mind that in a lot of cases, if someone has hemorrhoids and there's bleeding, it's usually connected to their hemorrhoids. But if you talk to your primary care doctor or a gastroenterologist, they may say, we want to rule out, we want to make sure there isn't cancer. So they may even recommend a colonoscopy at an earlier age than that time frame. Or if someone's in that age frame already between 45 and 74, they may say, okay, then we might recommend that you actually do the colonoscopy. So we can just make sure that's just hemorrhoids and not something else going on. 50% of people will have HPV in their life at some point in time. And the body, fortunately, HPV tends to be cleared. We get it, and then our body gets rid of it. For people who are older, they're more likely to have been sexually active and they're more likely to have had different sexual partners as well. The likelihood that they've already had HPV is pretty high. So a vaccine is not going to prevent their body from getting HPV in the first place. So that's why the recommendation is really for people to get their initial HPV vaccine before they have had sex at all or have been sexually active for that matter. However, we know that it can still be helpful a little bit for people who've had sex before. That's why has been broadened out to for people in their 40s, even if they haven't had it done already, haven't received the HPV vaccine yet. How can this vaccine benefit the most people, the most that it can? That's why it's first for people who are adolescents and then people who are adults and have already been sexually active.
I think a lot of people get a little bit freaked out thinking, oh, my 12-year-old is not sexually active. It's yes, that's the point. We're trying to prevent this before it ever happens. That's the prime time to make sure that they're protected. So just throwing that out there for anyone who might have preteens or teenagers that qualify for that.